I'm really excited about the Heater Road project. Dartmouth-Hitchcock for a long time was a leader in primary care. And over the last decade or so, we've sort of lost our leadership role. We had the Dartmouth Co-op that John Wasson and others ran for years that was really a model for this country. And looking at collaboration across our region to take care of patients, really in the early kind of medical home models, although it wasn't called that at that time. And I really think that the Heater Road project gives us an opportunity to really take advantage of thinking about the new models for primary care and how we take care of patients and their families in more convenient ways across disciplines. So we need to think about what that workforce is, doctors, nurses, students, community members, to manage these populations. And hopefully Heater Road will be a nice place to gel some of these things together that will be really exciting for the community. As Dartmouth-Hitchcock wants to lead healthcare transformation for our region, and oh, by the way, the nation, we need to think about how we use regional resources. And most of our regional care is Vermont and New Hampshire, but we're also reaching into Maine to work with the Maine health systems. And we're, of course, working nationally with the High Value Collaborative to work on a national strategy for utilizing resources. But in our region, we want to maximize the effectiveness of all resources without building new resources where we can. Today, as we think about the cost of care and our capacity to manage the population, we're pretty much full with our beds. We're in the top 5% of taking care of the sickest patients in this country. To sustain the facilities and the high technology you need in the subspecialty facilities for specialty care when people have, neurosurgical needs or spinal cord needs or cancer needs, you need the kind of facility Dartmouth-Hitchcock offers. It's the only academic medical center in this state, and it's an outstanding one. And the people of New Hampshire, I think, are proud of it. I certainly am, of what we provide for our state. But we need to look to other venues, other facilities that are cheaper to provide care that's not subspecialty care outside of a hospital, so we can lower the costs for our employers, our employees, and the people of the state. To some of our facilities on Buck Road, we're not state-of-the-art. And we needed to move some of our primary care physicians out of facilities that were less than adequate in taking care of our patients. We needed to free up space in the hospital to get those really sick patients into our system from the region. Moving dermatology out, moving some of the physical therapy and functional restoration programs out will allow us to utilize this subspecialty facility in a more effective and efficient way. This is a great step up for the physicians that practice in our primary care practices, and it's a step up for our patients who want to utilize these facilities. And when I say a step up, I'm not talking about a nicer building. I'm not talking about a nicer building. I'm talking about how we're going to provide the care for people in a better way. Our culture of caring is about how do we provide for you and your family the kind of health care services you need. Sometimes it's a simple touch, a pat on the shoulder. Sometimes it's getting a blood test the right way that's not painful. Sometimes it's getting a new image to help us diagnose a cancer or a broken bone. Sometimes it's a airlift with our helicopter system to bring you into managing your health, but what we're really talking about is taking care of you and your family, that personal touch, but with high tech. And we want to be high tech, but we want to more importantly be high touch.